Every family needs a doctor. In East Africa, there is only one doctor for 20 to 50,000 people. There are students who want to learn. They want to study family medicine so they can treat the real issues in the community. Family doctors can deliver babies, do surgical procedures, handle infectious outbreaks, and do preventative primary care.
In Uganda, where I come from, I had actually noticed that, you may actually be specialized, but that's not what the common person in the community wants. People come with diverse conditions, and if you really have to make an impact, then you really have to be able to care for children, for adults, for males, for females.
In many countries, people have to travel for days to get good medical care, and by the time they decide to begin the journey, it's often too late.
In Africa, most of the people who need our services are in the rural areas. So we need to motivate whoever family medicine practitioners to work in those areas. It is not going to be easy, we need to find ways, but I think we need to motivate them.
The last family we visited in Kambundo recently, that one was really touching because this child had relapsing episodes of TB. We want to see how the living arrangement is. If probably he's getting reinfected from the home. And we actually found out the living arrangement was really bad and we could have made a difference. And we discovered the dad was not working. He had no source of income, but for every single cent he made, he had been told there is a certain porridge he has to give the son. And that was so expensive. So everything he made used to go to buy the porridge. And the porridge was not nutrient rich. If we didn't go home, we'd be treating TB and treating TB and treating TB, but we are not looking at real issue in the community, in the home state.
There are training programs in Africa that will help students live and work where they're needed most. They learn to be community-focused doctors who are truly holistic in how they approach care. This is Dr. Botwala Moses. He trained as a nurse, then a clinical officer, and eventually went to medical school. After working in the small town of Jinja, Uganda, he decided to do family medicine residency. He said he needed to learn more so he could better serve his community. He started this year without any source of tuition or salary to support his young family.
As the few years I've been chair, it's like in the last group I got 6 students. 2 were unable to come. Totally, the district doesn't give them study leave, so they could not survive. And then the other 2 I have still don't have funding, but we are telling them, we are going to look around. So the issue of funding is a big problem for studies.
So the work is being done. The universities have great training programs, and their graduates have a major impact on health outcomes and cost to the health system. Patients are seeking them out because they feel understood and they learn how to better manage their family's health. Their students need tuition, cost of living, and research support. How can we work with them to get better health care for everyone?
Sako amajama siken konzo